Yeah, so thanks everyone for coming along to our GoShare gathering. We'll talk about it a bit later on, but this is our first, I guess, re-engagement piece for GoShare that we've had in a long time. So really excited to get this piece going. And yeah, as I said, I'll speak to it a bit later on, but we'll plan on having more of these community of practice sessions with our GoShare users across the region in 2025. So really excited to kick this off, and we've got a really good agenda today. But before we get into that, I would just like to start with an acknowledgement of country. So paying respects to elders past, present, and emerging, and any other Indigenous peoples that might be joining us in the room today. Joining from Wathaurong country in Ballarat. If you feel like it, you can chuck which country you might be joining us from today in the chat. It's always good to see everyone's zooming in from. So I guess we'll start with some introductions. So for those who might not have met me yet, they might have obviously seen my emails, but I'm Will Garner. I'm a digital health officer here at Westvic PHN, currently the GoShare lead for the program. We've also got Tom James here. He's a digital health officer as well. My manager, Sarah Crow, is actually off sick today. So, she would usually be here, but can't make it, unfortunately. So just looking at the agenda, I'll just kick off and just reinstate what the GoShare program actually is here at Westvic PHN. I'll then hand over to Dr. Tina Cambell from Healthily. She's a GoShare founder, and she'll just speak to the story and mission for GoShare. So that'll be really great to hear. We'll then hear from Andrew from Healthily. We've also got Michelle from Hamilton Medical Group just to talk about their experience with the recent pneumococcal vaccine recall campaign. We saw some really good numbers in terms of response rates and actually vaccination rates for that clinic. So that'll be really good as well. And then a bit later on, we'll just speak to what's going to happen next for GoShare. So what's going to be happening in 2025, some really exciting pieces coming up, including our community of practices. And then after that, we'll just go into Q&A and hopefully get some feedback from you guys as well. So without any further ado, I'll just go next slide and kick off. Also, just a reminder, please, it's very informal today. So if you have any questions at all, just feel free to take yourself off mute or write something in the chat. We've got Tom who's going to keep an eye on the chat for us, and he can reply to anything that you've got in there. So GoShare Westvic PHN. Currently, so our contract is providing annual GoShare licenses to 80 clinics across our region, that being general practice. As part of a license annually, you obviously get access to the platform for the year. We also provide 150 SMS credits that you can use to send your patients GoShare healthcare resources through the platform. So yeah, we're finding that at the moment, these licenses and SMS credits probably aren't being used as much as we see fit and as much as they could be. So yeah, probably why we're starting these community of practices, just to get everyone re-engaged and realizing how good of a tool GoShare actually is and how useful it can be in the clinic. As well as the SMS credits, we do, as I was saying, we provide you with 150. You're also welcome to purchase more through the platform yourself. We can provide instructions on how to do that and any support required. So the next stop point there, just talking about other integration pieces that we're working on through other Westvic PHN streams, such as our Your Care Path service model. So looking at sort of the allied health side of things and integrating GoShare through that, and just seeing which service model sort of best fits the GoShare use. A couple of important things to note for your clinic. So when having a license and actually using GoShare, we recommend identifying a GoShare admin. So that will most likely be someone who I guess will have some governance over GoShare in your clinic. as well as being just a contact person for us to reach out to, and being able to speak to about GoShare and any, I guess, news or updates or anything important that we need to reach out to you about. Ensure that all required staff actually have a login. So if that's the case, you don't know who has a login, you can simply reach out to us and we'll let you know who has a login. We can help you update those who has access. If you've forgot your password, you can reset that through GoShare. If not, we can help you out with that as well. And the third dot point there we've got is just have your organizational details set up and up to date in GoShare itself. So you initially do that when you first log into GoShare, but you can update those details as well through some settings in GoShare. The other thing I wanted to point out is we've recently just added a GoShare webpage to our Practice Connect website. So this is a Westvic PHN set up website where we upload any, I guess, resources basically for any health professionals in a general practice. So I'm not sure if anyone can click on that link on the slide there, but that will direct you to that page. It has all news and updates that are relevant to GoShare at the moment, and we'll make sure that they're live and up to date moving forward. I'll provide some more information on that in an email after this session. And also just to reinstate that, like, we're providing support to general practice and others using GoShare. So if you need any support, please contact digitalhealth@westvic.phn.com.au. Yeah, so that's a kick-off, Tina. I might just hand over to you now. I'll stop sharing and then you can share your screen.
Thanks, Will.
Thanks.
Thanks. I'd also like to thank you, Will, for setting up and doing all the work to set up this community of practice, because I think it's such a fantastic opportunity to share with Western Vic PHN practices the new content, new resources that are available on GoShare, new functionality over time. Andrew Moore from our team in a moment will talk about the pneumococcal project, but you will learn along the way that there are many opportunities for you to use GoShare to drive quality improvement activities, and in many cases there's also the opportunity for a return on investment for your practices, which is important when you're investing in SMS credits. So I guess I'd like to give you a little bit of background so you know where we came from, and I guess I'd say that we started with a focus on patient storytelling. So what has driven us over the years is the sharing of patient experiences. I did some research in this area as well along the way, and we know that there's strong evidence around the use of shared experiences in healthcare. So GoShare came about to host a library, an enormous library that we had developed of patient and carer experiences, and to provide the ability for you for health professionals to share that content with their patients. But as you know, if you've been using GoShare, it's become much, much more than that. GoShare hosts a whole range of resources that you can share with your patients. Our mission is, and what really drives us, is to improve health equity, health literacy, and health outcomes by transforming patient education through innovative digital technologies. And it's really that very much the health equity piece, the ability to deliver equitable access to health information that drives us. I guess the problem that we're solving is, and that the reason GoShare exists, is to enable you to provide your patients with timely, relevant digital education. And it really is all about enabling you to deliver the right information at the right time, but via the most appropriate channel. So it might be SMS, it could be email, and I'm sure at one of these sessions we'll also talk about GoShare Voice, which is a conversational voice AI approach that we take. And you have the ability to deliver education and information in multiple languages. Again, we can provide more information on that. So those are the things that drive us. And we launched GoShare. In fact, we launched both Healthily, and Healthily was launched to take GoShare to market in 2016. So we've actually been in the market, used right across the country for patient education for quite a number of years. So, and forgive me if you already know all of this, but GoShare hosts a large content library, and you'd be aware that there's content including patient stories, animations, fact sheets, websites and apps. There's also more recently the ability to send PREMS and PROMs, patient-reported experience measures and outcome measures surveys to your patients with the data coming in to GoShare. And it has unique functionality. So it's that bundling of content, creation of content bundles that enables you to bring together multiple content items on a particular topic, which could be pneumococcal, it could be cancer screening, it could be any number of priorities that you have as a practice to communicate to your patients. But you can create multiple items within that bundle and very easily and efficiently send that content to your patients. There's reporting available, and GoShare is integrated with various platforms, which I'll touch on in a moment. But you might be interested to know that around 1.45 million patients received information from the GoShare platform in the last 12 months, and that's slowly increasing over time. And we're seeing really solid open rates as well. So you might have noticed this if you're using GoShare currently, that we see open rates on average around 42%. It does vary, and it really does depend on the topic and a range of other things. Just to quickly touch on how it works, there's a list of topics on the platform, and you can actually, as a practice, feature certain topics. So if there are topics that you use regularly, they can be brought to the top and highlighted in a different colour just to make it easy to access. And it's a little bit like online shopping. So GoShare is super easy to use. You just find the content item that you would like to add to a bundle, and you click the plus beside the item, whether it's a fact sheet or a video or a link to a website, and it appears in the bundle. But you can see there are multiple content types: patient stories, videos, including animations, info sheets, and apps and tools. I touched on integrations a moment ago, but we've got a very exciting and new integration with best practice that enables a range of features that I think Andrew can touch on in a moment when he speaks about the pneumococcal campaign. We're integrated with Medical Director as well. It's a simpler integration. And our most recent integration actually is with Fred Dispense Plus in pharmacy. But just to give you a sense of who we're working with, this might be of interest. We work right across the health industry. We work in primary care, as you know, but we work in tertiary care. We work with a number of state health departments. We work with universities on a range of research projects, more recently in pharmacy with our Fred Dispense Plus integration and others. But I might just pause there and thank you for your time.
Thanks very much, Tina. Such a great story, and it's, as you can see, it's such a simple tool to use and can be very impactful at the clinic. So thanks very much for giving us some time out of your day. Tina's at a conference today, so very kind of her to take the time and be here. I really appreciate it.
Thanks,
Tina. I'll share my screen again, and we're going to hand over to Andrew and Michelle now.
I just wanted to say I'm a key account manager with Healthily, and just to say, echoing what you thanking us, we really appreciate the effort that Western Victoria PHN and the practices and the practice managers all put in, to create successful campaigns with GoShare. And this one, what we're going to talk about now is a successful implementation of a vaccine recall strategy, effectively, or a reminder strategy, if you like. We're going to, and Michelle Brilley from Hamilton Medical Group will talk about her her experience with conducting this campaign from a practice manager's perspective. But I'll just give you a quick, I don't have any slides, I'll just give you a quick overview of how the campaign works. So when Tina talked about the use of GoShare, I think, let's say the primary use of GoShare is for a healthcare professional to select content specifically of benefit to a patient and send that bundle, if you like, to the patient by embedded in an SMS or an email. And the extension of that is the integration of GoShare with primary practice software. So initially it was Cat4, which many of you will obviously remember, NCAT. We integrated with Cat4 with the view for a practice to be able to run a list of patients for a specific outcome. And if we use the vaccine analogy, we started off with shingles back in the day of Zostavax. And so obviously the practice would use Cat4 to run a list of eligible patients, those who are over 70, I think, who hadn't had the vaccine. And then they could effectively send, using the integration of GoShare with Cat4, send an informative bundle of information inviting the patient to make an appointment for the vaccine. And the thing that separated this, because obviously SMS reminders or recalls are nothing new, but what made this so much more impactful was that it was a longer message than a typical 150 character hot doc message. It had the patient's name, the practice name, an explanation of why this was being sent, why it was important to have the vaccine, and basically it was an extremely successful campaign. We then rolled it out to a pneumococcal vaccine recall, and so the principle is still the same, but now not with Cat4, obviously. In many PHNs no longer use Cat4. And so we've got an integration with best practice that Tina talked about. So if you have best practice software, it takes maybe 2 or 3 minutes to download the GoShare. We call it PSI, the integration with best practice. And in the campaign, we basically book in a 15-minute session with the practice, usually practice managers or practice nurses, to actually just run the list and send out the recall SMS. I think as at the time of speaking, 285 practices across Australia in the last 12 months have actually participated in the campaign, and 10 from Western Victoria so far. And the average has been 17% of patients have actually made an appointment within 30 days of the SMS campaign. The single out of the 285 practices, there's been one practice has actually actually holds the record, if you like, for patient response, and it's Michelle at Hamilton Medical Group. And so I'll hand over to Michelle, and she can talk about her experience as running the campaign, so maybe some hints on how it can work, and then we can talk about if practices are interested to, if you haven't participated already, how you can potentially join and do this recall campaign yourselves. So maybe I'll pass over to Michelle.
Yep. Okay. Thank you. Yep. You can hear me, I assume.
Mm-hmm.
So we have a extremely large database of patients here and service a very large area. So a lot of our patient demographics are in the elderly age group. So we ended up with, obviously, as you can see, 1,488 patients. And to send out messages to all those patients was going to be a large amount of patients receiving messages all at once and tying up phones and various things to book people in. And we also didn't want to clog up our appointments. So what we then ended up doing is when Andrew and I went through it, we looked through our patient lists. So we use Polar to export our data because our software is ZMed, which doesn't integrate with lots of things greatly at the moment. But we use Polar and then use the GoShare Healthy application. We looked at the patient list to see how many patients fell into each individual sort of cohort before exporting them to CSV files to send out. So they were broken up into smaller groups, hence why there were 12 separate, lots of bundles or messages going out. And we did that over about a month. We also tried different ways of running our clinics when patients rang in. So we had patients would ring in upon receiving the message to book in an appointment with their GP. And we also ran, as it progressed, individual or specific vaccination clinics. So doctors who don't work full time would open up a session and they would do X amount of vaccinations for just the pneumococcal vaccine, and we could book people in one after the other for that. So then staff got involved with getting patients ready to go in. We'd have a couple of people sort of assisting getting people's arms out of jumpers and things like that, and nurses assisting the doctors. So doctors would open when they usually weren't working. So if they only worked, say one doctor didn't work Thursday afternoons, they'd open their session. Thursday afternoon is just do the vaccination, so as not to clog up our appointments. And we could just extend on the time they open. They'd start with initially an hour and go from there. We'd do some at end of days. Again, some would come in and see their regular GPs because some would like to do that. Patient feedback was good from the beginning. We did sort of preempt. We'd done a previous recall campaign or a campaign for the heart health checks, so we sort of learned a little bit of stuff off that. So what we ended up doing was we posted on Facebook and up around the clinic that we were going to be sending out the messages to, because initially with the heart health one, we had a few people thinking the messages may have been spam. But the patients in general responded very well to this, and they liked the bundles of information that they were sent out, that they could sort of look at at their leisure. We also had the staff engaging with the patients when they were coming in, but nurses, as we progressed, when we first started off, nurses would check air before the patients came in to make sure, A, the patient was eligible and they hadn't had the vaccine somewhere else. So there were some instances where they had to phone the patients and say, well, actually, you've had it at the chemist or another clinic or somewhere differently. So they weren't required to come in. And then we would update that information on their clinical file, and obviously not submit it to air, but that it was updated for our records for our doctors. As I said, staff engaged well. We had medical students even that ended up getting involved and wanting to assist with it so that they could vaccinate patients as well. I suppose the biggest thing from our point of view was to consider at the time was the supply of vaccines. Were they available? Are we able to get them? Because there was no point sending out all these messages and then not being able to get the vaccine, source them. Also from a clinic point of view, so manpower, so doctors and nurses and staff being available to run clinics, hold clinics, not on leave, not cutting into a lot of our appointments, which is why we then sort of pivoted slightly to the specific vaccine ran clinics. And as Andrew, Will and I touched on yesterday, you wouldn't want to run these type of clinics at the same time as you were doing a flu vaccination clinic, because obviously you're busy enough with doing those. We'd probably look at now, because it's an elderly population that don't tend to, they might go away for Christmas or whatever, if we had the manpower and the people at the clinic, we'd potentially probably look at doing some of these maybe middle of January, because a lot of elderly patients go away for Christmas and come back where people with families and things are off on holidays. But that's dependent obviously on whether your manpower at your clinic is obviously there to be able to do that. But we've tried various different things over the time, but we found that, yeah, once we got this process down, exactly how having nurses checking and specific clinics that seemed to run the best. But yeah, we had a really, really good response to it. And this is the second recall campaign we have done, or campaign, and we found that they've both been really, really good. So that's probably all I have to say very, very quickly.
Fantastic. Thanks, Michelle. Yeah, really great to hear that. And yeah, sounds like a really important campaign that has been for your clinic, given the large amount of patients that you actually sent out to. 1,488 is a huge effort, over 12 separate sends as well. So you've done a great effort. One thing I just did want to ask you is, what would you say to a clinic that might be a bit hesitant to take on a campaign like this using GoShare, or any other digital health tool?
I think at first when you start to do it, you need to check your patient numbers to see how many you've got. Like obviously if we just exported a list, sent it out, not looked at it, our switchboard and phones would have gone mad, and I would have had the receptionist in and the phones tied up and whatever else. Once we sort of broke them down, we looked at how we do the clinics, and then we sort of improved as we went along. So we didn't initially start checking the patients on air to see if they'd been done pre-booking them in, and we were doing that when the doctor would come in, or the doctor would see the patient, or when that patient would attend the clinic. And that was a waste of time for some people that rocked up that we didn't necessarily need to see. So then we fine-tuned that. I think once you get your processes and things into place, and you sort of pivot as you go and adjust things as you go, once you're all set up and got a good system running, it's really easy to use. And it was very quick. Like Andrew and I, even though we did 12 separate sends and we touched base over those 12 separate times, it really wasn't any longer than probably a 10-minute phone conversation, get the file done, sent out, off we went. So it was really easy and simple.
Yeah, no, fantastic. Yeah, as you said, there's obviously a few pieces and processes to a big campaign like this, but from what I'm hearing, GoShare has been a really great enabler to actually help you achieve that, and the ease of use is a massive aspect to it as well. So yeah.
Yep.
Anything else to add, Andrew? Or
yeah, thanks, Will, and thanks, Michelle. That's just some really great insights into how you manage such a large campaign, obviously with so many patients. The average number of patients per practice across, I mentioned the 280 odd practices, is 360 patients. And so Michelle took on a massive task. There are probably two parts to this. If you do happen to have best practice software, all that is automated. So there's actually a cap, and it will split up the send each week so that Michelle, if and I'm not trying to advertise BP here, but it would have essentially just sent every week without the extra sessions. It would have automatically just sent it in manageable times. Will has created a polar walkthrough that Michelle used for practices who don't have BP. And so in that, you just simply are able to use Polar to run the list of patients. And then usually if you're averaging around 360, 400 odd, 500 patients, you would just simply split the list in half, and we guide you through the sending steps, as Michelle mentioned. And Michelle, you're too kind, because I think I only showed you once and you did the rest.
Yeah, but that was because Will's instructions too, and between Will, yourself and I, like Will's instructions and pictures and everything, it's sort of like a guide for so you got the instructions plus the pictures.
Yeah, and there's one statistic, Will, that I like to put in every time. There was a study of the Prevnar vaccine and its efficacy, and reduces the risk of someone aged over 65, or obviously in Australia 70, but it was a US study. It reduces a patient's risk of hospitalisation or ending up in ICU with pneumococcal pneumonia by 71%. And so I think everyone has someone close to them who has ended up in a dreadful experience in ICU. It is such a good strategy to do, for a patient group in Hamilton or anywhere in Western Victoria or Australia. So I urge everyone to consider doing it. Back to you, Will.
Yeah, thanks, Andrew. Is important to note as well, as Andrew was saying, that this campaign will continue on in 2025. So if it is something you are interested in participating in, you can reach out to us at Digital Health, or as I pointed out at the start of the presentation, we've got the EOI link actually on the Practice Connect webpage, so you can register through there. So yeah, thanks so much, Andrew and Michelle. Really appreciate your time and effort for today. Really good to hear what a great success story that was. And yeah, if we could have, as you were saying yesterday, Andrew, if we can even have one more clinic participate throughout our region, how much an impact that will have on our communities. So yeah, thanks very much for your time. So what's next for the GoShare program? So what's going to happen in 2025? Hopefully a lot. We've just listed a few things here. More GoShare Gathering. So we'll hopefully be planning another 3 of these sessions next year, looking at one in maybe Feb, March, and then one a bit later in June, July, and then we'll have one at a similar time at the end of the year to this. So yeah, expect to receive some more communications around these community of practices. Be great to get some more people along. So if you have any other connections with clinics in your area that you know are using GoShare, or even if not, be great to get them on board and to come along to these sessions as well. The more the merrier. And some conversations such as the one we just had are really great to hear and share those good news stories. So yeah, keep an eye out for those communications. The next dot point there I've got, and this is to be confirmed, but we're thinking about starting up a build your own campaign project. And this will be dependent on a few things, but just hearing around the pneumococcal campaign, we might be looking at aligning a similar thing with our community of practices, in that each clinic might get the opportunity to create their own specific campaign dependent on their patient cohort. So something that might be really important to them and really impact their patient cohort. So that's all I'll touch on that one. It's not set in stone at the moment, but that might be a really exciting project. Obviously, individual support and training will be reaching out and hopefully coming out to clinics and providing some further support and training. It's really good when we actually get to come out and see how people integrate GoShare into their day-to-day workflows. So hoping to do a bit more of that. I already touched on that, the pneumococcal vaccine continue on in 2025. So as I said, you can access that on Practice Connect. I'll share the link with that in an email after this. Otherwise, reach out to our digital health email. We'll be happy to direct you in the direction for that. And Andrew sort of touched on this as well before, but the GoShare PSI integration, so currently available for people using best practice software. So if you are using best practice and using GoShare and you're not sure if you've downloaded the software yet, please reach out to us and we'll help you in terms of providing more information on the integration, as well as any training or upskilling needed. So they're just a few things to expect over the next sort of year and so. Yeah, that's pretty much it for today. I will just open the room for a Q&A now. If anyone has any burning questions or comments, any feedback around the GoShare program or GoShare itself, about today's session, I'll open it up for a minute and see if anyone has anything to add. Otherwise, there might be wrap up time.
Will, I just wonder if we could ask a question of the people attending from practices today, whether they would be happy to share their patient education priorities. Are there any particular areas of health communication that they're interested in at the moment? We've got some great heart health check content available on GoShare. You might be aware that we were the Heart Foundation's partner to deliver the Heart Health Check project. So that's definitely something that we can help you with. Diabetes, thanks, Michelle. And there is so much content available on diabetes. I think there's an opportunity to create multiple content bundles to cover various aspects of self-management. And we also have on the GoShare platform a suite of around 100 short videos developed by Western Sydney Local Health District, or by Western Sydney Diabetes actually. But the videos themselves are amazing and cover off at a very granular level a whole range of aspects of self-management. So we could help you there too, Michelle.
If I could maybe add something to that, to Will, talking about choosing what would be a priority for the practice. The 10 QI measures, I think we have supported almost each of those measures. Michelle, for example, you could run a list of patients who haven't had an HbA1c recorded in the last 12 months, QIM1, and then send them a message to engage them with what is HbA1c. But we urge you to come in and have a. But if we talk cervical cancer screening, flu vaccine, pretty much we're able to support. And Will, this is obviously a discussion that you guys are having, a preliminary one about choose your own project or choose your own campaign. But just to throw that thought starter in is almost any QI measure can be supported by a GoShare campaign.
Tina,
but thanks to Andrew. Oh, sorry. Yeah.
So, can I ask a question? You just mentioned that you've got a wide range of information regarding diabetes, and obviously, as Andrew mentioned, you've also got more information on other aspects, other parts of the disease management. Is any of this information, is there a possibility of sharing any of this information on social media as well as GoShare? For the simple reason, something that, sorry, I'm terrible with names. Please forgive me. Michelle mentioned is we've got a demographic that's predominantly over 65. We've had lots of incidents of patients being hacked. We've had lots of incidents of patients being having information taken off their phones. So they're very, very wary of opening links on their phones, on messages and things like that. However, they are very active on our social media. So is there any way of not to bypass GoShare, because we do also have we've got alternative, some people who are very active on there, who are very happy to look at their messaging. But is there an option of using some of the content on our Facebook page, on our social media? Because we do have a lot of people who tack into that as well.
It's such a good question. So we'll need to probably have a chat with the content owners. So, for example, I mentioned Western Sydney Diabetes. We'd need to have a chat with them. Any content that we have developed, yes, you'd be able to, we'd be quite comfortable with that. A lot of the patient storytelling resources have been edited down into little social media clips. So there is an opportunity there. So we could definitely take this offline and perhaps with Will and the team continue the conversation. But I think it's a really good point.
Can I just say, from the heart health check point of view, we did it in 2021. So I just brought up on my screen here what we did. We sent out 1,657 messages for heart health checks. And out of those messages, they were the people who met the criteria. We had 254 patients attend for heart health checks. And we had another 200 people on our wait list, because we got people to ring in and express their interest first. And then we had the nurses check that their blood work and everything was up to date before we got them in to actually have that heart health check. And now we have the recall set up on our ZMed reminder system and so forth. So these people that are eligible come in every 12 months now and have them done. So we can average 20 to 30 of those a month easily. And I found them very beneficial, because they've actually picked up some things that the patient may not have even come into the doctor to even mention, let alone when they've had their ECG, their bloods, and the nurses had a bit more time to talk to them, have picked up stuff with them. So we had a really, really good response to that.
Thanks, Michelle. Fantastic.
Well, that just about brings us to time. I just want to leave the last couple of minutes, take some time to provide some feedback on today's session. If everyone can please scan the QR code there with their phone, that'll just direct you to a Microsoft form. There are some questions there about next year's session. So if you can please outline what days and time of day would best suit these sort of sessions, that would be fantastic. There's also some questions later on in the form just about how we can best help you to integrate GoShare into your day to day. Lauren, I have seen your comment there. I'll take that on note and I'll get back to you on that one. Sorry, we've run out of time, but thanks so much everyone for coming along today. Really, really good session, some really good conversations had, and yeah, can't wait to get things rolling again in 2025 and re-engage about GoShare. So thanks everyone for your time. Enjoy the rest of your day and the rest of your week. And if I don't see everyone before Christmas, New Year, which is likely, have a great break and holidays.